Hello, Dr. Kathleen Young, board certified child, adolescent, and adult psychiatrist. And I want to talk briefly about this triad of anxiety, so intense social anxiety or OCD or other related anxiety disorders, ADHD, and emotional dysregulation as being sort of a marker for autism spectrum disorder, or if you see that triad or have that triad of diagnoses, it should sort of raise your curiosity, pique your curiosity about whether or not you have autism spectrum disorder. I think it's so common, especially in adolescent girls with less obvious presentations of autism, to get diagnosed with a whole bunch of things, and in particular in these three areas. And I think a lot of that is, lack of education, even among mental health professionals, about autism spectrum disorder. I think we, even in the mental health field, see autism in a very outdated way, and weren't always taught how to recognize it. And so it can be easier, or at least it's more common, to just kind of give people a lot of different diagnoses that all kind of go together. And so, and I think people feel more comfortable giving these certain diagnoses to people because, as a society, we still really stigmatize autism spectrum disorder, unfortunately. And I think people feel very uncomfortable making the diagnosis, looking for the diagnosis. They want to make sure it's not something else instead. And that's a great thing to do in theory. But what I find is when people get the diagnosis, they feel relieved because it finally all makes sense. They may have gone through their life with like 3, 4, 5, 6 other psychiatric diagnoses and never feel like any one thing fully explains what they're experiencing. So when they get the autism spectrum disorder diagnosis, they feel relieved. So if you're a parent and your child has these three things, or if you're a person and you have this, I think it should sort of lead you in the direction of wondering whether this is autism spectrum disorder, particularly if you've had difficulty with relationships. I see adolescent girls who move into adolescence and lose all their friendships, or if you have slow processing speed, so everything feels like it takes you a long time, or you shut down when things start to move too fast. These are the things that should sort of push you in that direction to wonder, to suspect this might be autism spectrum disorder. Hope that helps.